Thank you, Camille. Good afternoon. My name is Brian Bayless. I'm a person in recovery, and I have the privilege of serving as the CEO of Thrive Peer Support. And it's a great pleasure to have this opportunity to share our story and the great work of our team with you. Before we get started, I'd like to say thank you to Camille and the Northeast Ohio Hospital Opioid Consortium for giving us this opportunity to present today. In particular, I would like to thank Scott Osecki, the CEO of the Cuyahoga County Adams Board, for their support of our organization, and Dr. Joan Papp and Carolyn Tabayan and Metro Health for an outstanding partnership as together we shaped our innovative model of care. 2 years ago, Thrive ED was just a concept that evolved out of our collective perception that there must be a better way to address the continuing need of our opioid-addicted citizens who found themselves in the ER getting great treatment and resuscitation. Through many iterations, we refined our methods and approaches, and I would like to thank our other current health system partners, including St. Vincent, University Hospitals, and Ohio State University, who have built on and expanded our original work. I'd also like to thank University Hospitals as well. Additionally, we look forward to the Cleveland Clinic soon and coming on soon, and we would also welcome the opportunity to serve the VA as well. I would also like to recognize the support of our elected leaders locally, regionally, and nationally. Thank you to Cuyahoga County Executive Armin Budish for allocating generous funding for the Thrive ED initiative. To U.S. Attorney Justin Herdman for all his great work his office has done to combat the opioid crisis and to lead our task force. To Senator Portman for all of his successes with the CARES Act funding and for joining us today to learn more about Thrive ED. Thank you to Vince Carafi and the Cuyahoga County Department of Health for all their great work in securing the CDC grant. And a special thank you to Admiral Girar for his interesting opening remarks. It is only through the collaboration and support of many that the work you hear about today is possible. With that, I would like to turn the presentation over to Mackenzie and Justin, two of our outstanding team members whose commitment to our community comes through every day in the work that they do. Mackenzie and Justin.
Good afternoon, everyone. Thank you for giving us the opportunity to share a little bit about Thrive with you. A couple of objectives for today's presentation. We are going to start by educating all of you on the role of a certified peer supporter and how it operates as a service to support recovery. We'll provide some background on Thrive Peer Support, including some specifics on Thrive's different services. And then we will talk about our Thrive ED program and the opportunity we've had under the opioid settlement funding to greatly expand that. Next slide, please.
Hi, everybody. My name is Justin Larson, and I'm the Director of Health Systems. So I'm going to speak a little bit as to what is peer support. Well, peer support services are for individuals seeking recovery support for mental health and/or substance use disorder. Peer support is based on shared lived experience and promotes recovery, self-determination, self-advocacy, well-being, and independence. The certification process to become a certified peer supporter includes 16 hours of online e-based academy courses, a 40-hour in-person training, a state exam, and then followed by a BCI and FBI background check. So peer support is essentially the peer-to-peer model. It's one person with sustained recovery sharing their story with another person seeking recovery. Sharing their story informs the peer that I've been where you're at, I know how you feel, I understand what you're going through. Peer supporters embrace all pathways of recovery. It's a non-clinical role. Conversations are very organic and guided by the peer supporter, but driven by the peer. Peer support is about establishing a relationship and building trust by sharing lived experiences. Especially in early recovery, a peer may need their hand held, so to speak, while taking the first steps. A peer supporter understands this, and that's where that connection is so vital. Next slide. So here are some areas that peer supporters can assist their peers depending on what stage of recovery the peer is at. A peer supporter has been through all of this, and helping a peer navigate their own recovery journey is the goal. Peer supporters use their own lived experience to help peers overcome certain barriers in recovery. The peer recovery supporters link peers to resources for treatment, food, clothing, shelter, employment, education, as well as modeling sustainable recovery. Next slide.
So a little bit about Thrive in particular. We are certified by the Ohio Department of Mental Health and Addiction Services to provide type 84 mental health peer support and type 95 substance use disorder peer support. We were formed back in 2018, originally through a combination of Thrive Behavioral Health and the live peer support component of Ascent, which was a mobile app. Since May of 2018, we have grown very rapidly. There were 6 people in May of 2018. We now have a staff of over 130. We have about 2 orientations per month, so that continues to grow at a very rapid pace. And over 100 of our employees are peer recovery supporters, individuals with that lived experience in living in recovery. We currently provide peer support services in 30% of Ohio counties, and I say that to exclude telehealth. Due to COVID, we are able currently to provide telehealth statewide, which is amazing, but we have peer supporters physically in 30% of Ohio counties. Next slide, please. So peer support is really the heart of what our agency does. We provide these services in all sorts of different venues. You can find us in correctional facilities, hospital settings, or community-based peer support. And there's kind of another clinical arm to our community side. We have a growing clinical team. I believe we're up to 5 counselors now. They are able to do assessments, treatment planning, and counseling for those individuals who are engaged in community peer support with us. Next slide. This is, oh, I think we skipped one. If not, it's okay. There you go.
So where will you see Thrive peer supporters? We try to meet the peers wherever they're at whatever stage of recovery. If they're seeking recovery, we just try to meet them where they're at. So we are in hospital systems. We're in Metro Health, OSU Wexner East, St. Vincent Charity Medical Center, university hospitals via telehealth. Due to COVID, we are in the Cuyahoga County Jail, and we're throughout the community or throughout the state in the community.
Next slide. This is a snapshot of our 2019 data, which is sure to look different than our 2020 data. We had 1,127 unique individuals referred to Thrive Peer Support last year. 73% of those went on to engage in peer support services. We're very proud of that engagement rate. We commonly see opioid abuse as a substance of choice for our peers. About nearly half of our peers identify as struggling with opioid abuse. That's followed by alcohol abuse. We see a lot of that. I'll be very interested to see what the 2020 numbers look like and if there's a change, but I still anticipate a strong opioid abuse showing up. We have a lot of peers who are dually diagnosed as well. So they're struggling with mental health diagnoses and substance use disorder. About half of our peers who are dually diagnosed or struggling with mental health are struggling with depressive disorders. We have, that's followed by anxiety. We do have some peers who identify as having schizophrenia or schizoaffective disorders and bipolar. And last year, we provided 2,719 face-to-face visits. We were not doing telehealth at that time, so this is just in person, and documented nearly 325,000 minutes of peer support, and this was all in the community setting. Next slide, please. So in the hospital setting, there's a lot of unique benefits of having peer supporters there. For one, it provides a therapeutic relationship for that peer. Peer and patient are kind of interchangeable. So if I'm saying peer and there's physicians on here, you can think of them as your patients. They often present in emergency departments in crisis. They may have just overdosed. They may be experiencing some type of medical diagnosis related to their substance use disorder, and they're able to connect with someone who's been where they are. A lot of our peer supporters, they might have even had the same experience. They might have overdosed at some point. So it really is a therapeutic and a very connective relationship for them. It helps minimize the workload of providers in the emergency department. Some feedback we get a lot is that physicians and nurses, they didn't know what to do with these individuals who are showing up multiple times with the same type of overdose scenario. And we are happy to step in and kind of provide a continuing care solution that works for them and for the peer. Decreases emergency department visit time and total visits. Our peer supporters are there to link them to continuing care. So we're trying to get them out of the ED and into something that's going to support their recovery. And they do a really good job at that. Provide linkage to other self-directed programs. We provide linkages to detox programs, outpatient, inpatient, community peer support, all sorts of resources. And a really unique feature is that most of our peer supporters, all of them really, are very active in the recovery community. So they have a really good understanding of what those resources are and what's going to be the best fit for the peer. And perhaps most importantly, being individuals in recovery, they are really able to model to the emergency department staff what this could be. They do a great job of reducing the stigma associated with substance use disorder. They were all those peers at one time, so it's great for the staff as well. Next slide, please. So this is a glance at our workflow. This workflow is the one we are currently utilizing in Metro Health, Ohio State University, and St. Vincent. It is the in-person workflow. The way it works is a peer presents in the emergency department with some type of substance use related incident. The hospital staff then identifies them as someone who might benefit from peer support services, so they put in that referral to Thrive, and Justin will kind of show you the different ways that can happen. Our peer supporters will request certain information, just kind of to know what they're getting into, the reason they're there, current medications, things like that. And then they do the important work. They go, they introduce themselves to the peer, and they really start helping the peer advocate for their next move and those choices to support their recovery. From there, the peer supporters work very closely with the hospital staff when needed. We're coordinating their care. They're pretty much setting goals with the peer and assisting with those linkages and referrals. Sometimes they might need certain things from the hospital staff to get them placed. They're always very cooperative, so it's a great relationship. And then we are able to go so far as riding with the peer in an Uber to treatment. I mean, it's a very much a warm handoff. They can leave the hospital. They can link them directly to those services. And I mean, Justin has so many stories like peers who are withdrawing and they're just in a really bad place, but their peer supporters right there with them and gets them checked in at the treatment center. And I think that's really crucial with this. And next slide, please. So the implications of COVID required us to modify our in-person workflow to expand into university hospitals. And we did that through the use of telehealth, which is, you know, what pretty much everyone's using right now. So it works basically the same way, except for it's all on the Zoom platform. The UH staff will identify someone who presents with an opioid overdose. They will then call in a referral to Thrive. We have a 24/7 staffed line for all 6 of the Cuyahoga County EDs. We will work with the hospital team and ultimately set goals with the peer over the Zoom platform and get them into treatment. We didn't know how it was going to work at first. It was very new for us as well, but everyone's really getting their footing with it. And it's so exciting to see very similar engagement rates in terms of connecting them to treatment. You know, we see about 75 to 80% of our peers connect to treatment in the hospital, which is huge. And we're seeing very similar numbers with UH, so we're thrilled with it. Next slide, please.
So introducing peer support services to the peers, and again, that's patients in the emergency department. These are just several phrases that the medical staff can use for introducing a peer supporter. If you ask your patient, you know, obviously, how can we help you? But then really letting them know that there's a person with similar experiences that can relate to them. Would it be okay if we have someone speak with you regarding resources? Do you have a minute to speak with a peer supporter? There are several ways to introduce peer support. It's important to let the peer know that help is available and it's a person with a similar experience. Next slide, please. So how to contact a Thrive peer supporter in the hospital setting. We're available via telehealth and/or in person, depending on which hospital. We have dedicated lines 24/7 for those seeking help. Next slide.
Just a little snapshot for demonstrating success. This is data specific to our Thrive ED program. That yellow column on the far right are 2020 projections, and those are based on the actual numbers for the first 2 quarters of 2020. So if we're looking at Metro, you can see Metro has just really been the model for our entire program. We really feel like we kind of perfected the work that we're doing there, and we are now in a place where we're able to replicate this and bring it to other systems and do that successfully. So we're projecting about 1,400 peers in Metro Health this year. We see them primarily in the emergency department, but there has been an interesting trend with COVID where we've seen a slight decline in ED referrals and an increase in inpatient referrals. So patients who present to the inpatient setting and then the nurse or social worker identifies them as having a substance use disorder, and Thrive works with them for their recovery. St. Vincent, we launched that in the fall and it's going great so far. Great partnership there. That is done through the CDC funding, administered through the Board of Health, and we're very appreciative of that relationship. OSU has been going for, it started about spring of last year, so it's right on track to have a similar outcome again. We see peers at OSU both inpatient and in the emergency department as well. And at UH, those numbers projected are telehealth only at UH, so it's 6 emergency departments at UH via telehealth. Next slide. So actual Thrive ED peers to date, you can see here what I've done with the blue column is those are the total referred, and the right column are the total linked onto additional recovery services. So about 75% of the peers we interact with go on to take a referral to detox or outpatient, inpatient peer support, something to that effect, which, you know, I think that's really the most important work that our peer supporters do. These people need help and are looking for help, and they put a hand out and give them help, basically. It doesn't get any better than that. Next slide.
So I'm a person in recovery myself. I'm a certified peer recovery supporter. I'm a supervisor. I have been one of those patients in the hospital, a peer. So this is really, this is a letter from a peer. Obviously the names have been changed. But this is, for me personally, this is why I get out of bed in the morning. This is why we do what we do. This is a prime example of the benefit of peer support services. Peer recovery support provided verbal support while sharing from their own recovery stories and consistently showing up to help this peer, and they instilled hope. They modeled recovery. They didn't give up on the peer. You can read it for yourself. The peer reported, "I had no will to live." They kept coming and showing up to talk to me. It gave me a little more hope each time, to the point where the peer is excited for his recovery. He's scared, but he knows someone's there with him to be along with him in that journey and to help guide him. They believed in me when I couldn't believe in myself. I'm forever grateful. We have so many stories like this. Um, Sometimes it's just about planting a seed and letting the peer know that there is a chance for a better way of life. There is hope, and we're going to be there no matter what, and we're going to keep trying. We're so thankful to be able to do this. Next slide, please.
And I want to take time just to reiterate the Thrive ED program. It is truly a partnership. It would be impossible without the support of our community partners. So a huge thank you to the Adams Board. That opioid settlement funding is how we're bringing this to UH, to OSU for their partnership, to Metro Health for their partnership, and again to CCBH for supporting us with that CDC funding.